Hello, good morning. Sorry, good afternoon. It's actually my morning going to afternoon. Thank you so much. My name is Dr. Chudi Ufondu, and the name of my organization is Snowspirations. And this afternoon, we're going to talk about ovulation. We're going to look at ovulation from a very broad perspective. What's ovulation all about? What are the basic fundamentals of ovulation? What do you need to understand about ovulation? And I have a very good friend, my teaching model. I'm going to use this to illustrate ovulation. Now, it's important to understand that without ovulation, you cannot become pregnant. So, at the center of the quest regarding starting your family is ovulation. You have to have an egg, and not just having an egg, you have to release that egg to have a chance to become pregnant. Now, some women might not really understand the nitty-gritty of ovulation. They might mistaken it for so many things. There are so many assumptions. Now, there are a couple of things that can affect your ovulation. There are a couple of lifestyle that can enhance or damage your ovulation. The common denominator is the fact that every woman from childbirth has the potentials of becoming a mother. So as you're coming into this world, God already gave you your ovaries. Inside your ovaries, you have your eggs. The process of releasing that egg is simply what ovulation is all about. Now, there are a couple of things that might affect the way that ovulation was ordinarily structured to happen. That's what we're going to try to discuss this afternoon. Now, I want you to pay attention to the details because if you understand it better, then you can make positive impact towards starting your family. There are so many things you might think you understood, but you might understand it properly. Or there are so many misconceptions. I'll give you one. Some women show up and they complain, Doc, I cannot see my ovulation. You cannot see your ovulation. The signs you might be having are non-specific signs that some women might have. The only way we can confirm you are ovulating or not is to go to a gynecologist and we run some tests and we confirm you are ovulating. Now, you might not have those telltale signs of ovulation, but you are ovulating. And some women might not be bleeding, they might have irregular cycle, but they are ovulating. So the common thing for every woman out there who wants to become a mother is to do what? To make love regularly. Because some people might have differences and irregularities and lack of pattern, but they are ovulating. Some people might have bleeding regularly, but they are not ovulating. So we cannot assume. There is no room for assumptions. We have to get it correctly. So I'm going to take time to teach this so we understand it better. The more we understand it better, the more it's going to help us to make informed decisions regarding starting our family. So thank you so much. I once again appreciate you. And I'm going to start. So ovulation simply means the process of releasing the egg or eggs from your ovaries. Okay? Now, ovulation is part of your cycle. The cycle is what happens in the body of a woman at a particular given time. So one of the first things I want you to be conversant with before we begin to talk about ovulation is your cycle. Every woman still in her reproductive phase is expected to have a cycle range from 21 days to 35 days. That's the normal range. So cycle is the interval between your bleeding days. So it's important to pay attention to the date and the pattern of your bleeding because the first day of your cycle is when you bled. The very first day you bleed is the first day of your cycle. So I want you to pay attention. I want you to use February as your guide, February and March. So go back to February and mark the day you bled first. That's your day one in your cycle. Then come back in March. If you have already bled in March, mark that day. Then count the number of days between when you bled in February and when you bled in March. That will be your cycle. When you have done that, now go to April. Start from the first day you bled in March. Start counting when you will bleed again in April. If you have a pattern, some people might have a regular predictive pattern. So some people might be bleeding every 28 days. Some it might fluctuate from 28 to 29 to 30. If you have 28, 29, 30, it's regular, it's predictable. You just need to find the average. Now, some women can have 21, 22, 24. It's also regular, it's predictable. You find the average. So some women might have their cycle towards the lower limit, and some women can have their cycle towards the upper limit. The most important thing is to pay attention to your body. Every woman's ovulation and cycle is unique. So during the process of ovulation, it's expected that the follicles are like the container where all the eggs that God gave you will reside. Now, as you are getting ready for ovulation, there will be development of one follicle called the dominant follicle. So let's use 28 days as an example. So before you get to your ovulation, the hormones that control the whole reproductive process in the body, progesterone, estrogen, FSH, LH, will start working on the whole reproductive system to make sure that one dominant follicle is released. The day the dominant follicle will be released is actually the ovulation day. The process of releasing the whole thing, it's what ovulation is all about. Once the egg is released, it's considered matured eggs. That egg is expected to go into the tube. And when it gets to the tube, it's expected that the sperm would have come in. When the sperm comes in and they meet in a special place called the ampulla, the released matured egg will meet the sperm. Now, the sperm will come in millions. There is only one sperm that will get that egg fertilized. Now, once one sperm fertilizes the egg, every other sperm will become inactive. And the union of the sperm and the egg will lead to a zygote. Now, over time, it will start dividing until it becomes an embryo. When it becomes an embryo, there will be a downward journey back into the womb. By the time it's coming into the womb, it's expected that the cover of your womb, which is called the endometrium, it's ready to receive the pregnancy. So when the womb is getting ready to receive the pregnancy, there will be increase in the thickness of the womb because it's under the control of an important hormone we call progesterone. When progesterone is very much enough and there is pregnancy, there is a particular substance called corpus luteum. This corpus luteum is supposed to produce more progesterone, which will give signal to the womb, hey, we are ready for implantation. So long as you're producing enough progesterone, so long as that pregnancy is viable. So what do I mean by viable pregnancy? Pregnancy is going okay. Unfortunately, in some women, the tubes might be damaged, so they might start having a ectopic pregnancy. That's a non-viable pregnancy. But if your pregnancy is viable, it's expected that by the time implantation will happen, which is what will happen after fertilization, the cover of your womb, which is called the endometrium, is ready. Once endometrium is ready, then the pregnancy will implant in the womb. This is called implantation. In some women, during this process of implantation, they will bleed. This is what is called implantation bleeding, which can happen to some women, not all women, and is completely okay. This can happen in pregnancy. So whenever you see any form of bleeding in pregnancy, it can be abnormal, it can be normal, but your duty is to report to your doctor so we can know if it's abnormal or normal. But implantation bleeding is spotting in women that are pregnant. It's not every woman that will experience this, but some women will experience this. So if every other structure in the body of a woman is going okay, it's expected that once you release your egg and there is contact between the sperm and the sperm is good quality and every other factor that mediates in fertility in pregnancy is constant, you become pregnant. Now, on the average, based on the cycle I mentioned, a woman is supposed to ovulate between day 11 and 21. So this is a range. So it's not fixed. It's not mathematics. Now, if you have a short cycle, the tendency is that your ovulation will tend towards day 11. So it's either it's going to happen on 11, 12, so the lower limit. If you have a long cycle, so that means if you're tending towards the 35, your ovulation will likely happen around the neighborhood of 21 days. So I need you to pay attention to my little details because they are important. Some women will have short cycle. Some women will have long cycle. If your cycle is tending towards the 21s, it's short cycle. If your cycle is tending towards the 35, it's long cycle. So the day you will ovulate will fall in between 11 and 21 days. Remember that the first day of your cycle is the first day of your bleeding. So very, very important you know this. Now, some women will not have regularity. Some women will not have everything I've mentioned the right way. They will be all over the place. 1 month is 45, next month is 65. Some women will even not have any pattern. The fact you don't have a pattern, the fact you don't have regular predictive cycle doesn't mean you are not fertile. You can still become pregnant with irregular period. So ovulation calculation and fertility window, it's meant for women that have predictive cycle. If you know a pattern, then you can begin to plot in the numbers. But whether you have a pattern or not, it doesn't matter. What matters is the fact that you're doing the right thing. And what's the right thing? PPP. You pray, you play, you practice. Now, let's talk about the symptoms. So how do you know you are? Likely gonna be. Remember, the watchword is what? Likelihood. Because the symptoms I'm mentioning are non-specific. So you can have it, you're not ovulating, or you might not have it, but you're ovulating. Number one, which is common among so many women, is increase in the cervical egg white mucus. So this is your cervix. The cervix is the junction between the vagina and the womb. So it's the neck of the womb. So when a woman is getting ready to release the egg, there are two hormones that play a role. Follicular stimulating hormone, which is a hormone that is produced from the higher centers, will go to the follicles, give a signal, they will start developing that dominant follicles. At the middle point, when we are sure that ovulation is going to happen, another hormone, LH hormone, will go up. It's called the LH surge. LH surge, it's what will signal to the body that in the next 24 hours, the egg will be released. When you are checking your ovulation test kit, what you are checking is the LH surge, luteinizing hormone. Once luteinizing hormone goes up, the possibility you're going to release your egg is almost 99%. If every other factor is constant, you become pregnant. These are standardized things you must know. So some women will notice increase in cervical egg white mucus. That's a commoner, non-specific sign you might be ovulating. Remember the word, non-specific. So it doesn't mean that once you have it, you are ovulating. You can have it, you are ovulating. You might have it, you're not ovulating, or you might not have it at all, but you're ovulating. So every person is wired differently. Now, some women will notice an increase in their senses, especially the sense of smell and taste. You will notice any slight testing, you can easily perceive good, bad odor, and you can have a lot of heightened sensation about what you put. Some women will notice what we call basal body temperature rise. So basal body temperature means when you wake up in the morning, you notice that you have a little spike, like you have fever. These are signs that your body is getting ready to ovulate. Some women will have tender, painful breast, swollen, tender breast. Tenderness means when you touch something, you elicit pain. So some women, if you pay attention to your body, you will notice that just about that middle point when you are ovulating, your breast is so heavy, it's so painful when it's touched by your partner. Some women will also notice what we call mid-cycle pain. Depending on the side of the ovaries where the egg is going to come, you notice some slight pain on that side. So if you notice monthly that you normally have pain on the left or the right side, it might likely be mid-cycle pain, which tells us that the egg is about to be released. Some women can spot. So in the process of releasing the egg, you can have little bleeding here and there. Now, some women can have fluctuation in their libido. For some women, it will go up. For some women, it will go down. Whichever one that happens, it's not specific. Some women will also notice some changes in the cervix. Some women will have mood swings. Some women will experience vomiting. Some women will experience headaches. Some women will experience bloating. So every woman is wired differently regarding how ovulation will affect your body. Now, this is what you need to know today. It will not always happen this way. There are certain things that can affect your ovulation. Number one is your age. As you're getting older, the possibility you will be ovulating every month is limited. So ordinarily, in the 12th calendar month, it's expected that at least a woman in her reproductive phase would have ovulated for 9 months out of the 12 months. But as you're getting older, especially if you get to age 35 and above, you are classified as advanced in maternal age. So what it means is the fact that the number of the eggs you have is reducing. The quality of the eggs you still have is also reducing. So we need to act fast. So when that happens, it simply means your chances are being reduced. Remember, it's chances. So your chances of becoming pregnant when you get to 35 is reduced. It doesn't mean terminated. You can still become pregnant, but you have to walk through a couple of hurdles. So you are gonna become pregnant easier below 35 if every other factor is into place. But people can become pregnant at any time. In our group, we don't preach ovulation lovemaking. We don't preach fertility window lovemaking. What do we preach? 48 hours lovemaking. For the fact we are factoring in irregularity, lack of pattern. So the days you think you are ovulating might be the days you are not ovulating, and the days you are ovulating, you will miss it. So some people will just wait for that particular day. They saw that increase in their cervical egg white mucus, but you might have ovulated before or after. So if you are only targeting that particular period to make love with your partner, you miss the chance. And once the egg is not fertilized, 24 hours, the egg will be inactivated. Your body will absorb it. So you need to be well arranged. You need to be targeted. The overall aim to make sure that ovulation works in our favor is to make sure that at any point in time, when you get to the vagina, we have very good quality sperm. What makes a sperm quality? Good count, good mobility, and good morphology. So once you have sperm waiting in the vagina, waiting in the womb, even if it's 5 days before you eventually release your egg, that sperm can get you pregnant. So your partner can make love to you on Monday and get you pregnant on Wednesday and get you pregnant on Thursday, 5 days ahead of time. So the best time you can actually try, we don't like using that word trying. The best time you can actually believe is to go 1 day at a time so you don't miss your chance for anything. Okay, so your age can affect your ovulation, your body weight. Some people are in the obesity range, some people are in the overweight range, some people are in the underweight range. Once you know how to calculate your BMI, you can use your BMI to know if you're healthy, if you're underweight, or if you're overweight. Your BMI should be your guide. Your BMI is not perfect. So if you plug in your height and your weight and you get the numbers, I want you to focus on the number 30. Once your BMI is hovering on number 30, you have a problem. We need to bring it down below 30. Once your BMI is below 18.5, you have a problem. We need to bring it up. So the normal range of your BMI we want you to be on is 18.5 to 25.5. We don't want it to be above 25. We don't definitely want it to get to 30. Once you are in 30, you have a problem. We need to deal with it. We need to find a way to bring it back to normal. So these are basic things you should know. Now, some women can also have hormonal imbalance. Some women can have chronic health problems that can also affect their ovulation. So anything that affects the totality of how your body is meant to function can affect your ovulation. Some women, it might be lack of exercise. Some women, it might be what you put into your mouth. Some women, it might be smoking. Some women, it might be drinking. So anything that affects the whole structural way your body is meant to function will affect your ovulation. Now, remember, as you're getting older, your chances of ovulation is dwindling. So the earlier you act on it, the better. Some women can actually have what we call an ovulatory cycle. You are still bleeding and it's confusing you, it's distracting you, and you think you are ovulating. But bleeding does not mean you are ovulating. So some women can bleed. Your bleeding is independent of whether you're going to get pregnant or not, because the hormones that will be getting ready to receive the pregnancy is completely independent of whether you're pregnant or not. So whether pregnancy is happening or not, the cover of your womb will start getting ready to receive a baby. What actually leads to bleeding is failure of pregnancy. So whenever you are bleeding, if you are ovulating, it's actually a confirmation that you can become pregnant. So when the cover of your womb breaks down, it comes out in form of blood. This is what you have monthly, which we call your menstrual bleeding. And the normal range of menstrual bleeding is 2 days to 7 days. So long as you're bleeding up to 2 days, that's your normal. So long as it's not exceeding 7 days, that's okay. We begin to have problem if you're bleeding for just 1 day or if you're bleeding for 8 days up. So these are standards you should be conversant with in our group. Okay, now I'm done with my presentation. I'm going to sit back and allow questions to come up. Now, I'm also going to use this opportunity to celebrate my daughter. You see, Zara, it's a special, miraculous daughter of mine. Zara was actually the reason why I delved into maternal health. She was born very early. So for some people that might have babies that came early, Zara was born at 26 weeks, way, way, way early. The normal range in pregnancy is 37 weeks, but Zara was born at 26, extremely early. She weighed a pound 13 ounces when she was born. She had so many challenges growing up based on predictable challenges. You know, she's not going to do this, she's not going to do that. But over time, she caught up with all those milestones based on care, based on love, based on availability of medical facilities. And since she started school, she's been an A student. She's done excellently well in so many areas. And she has kept on being on top of her class. So recently, she won a medal. So the medal I'm wearing today is my daughter's medal, Zara's medal, you know, based on academic performance. Currently, she's still maintaining a 4.0 CGPA. Amazing place to be. And this is from a girl that was never given a chance. So the reason why I'm using this is to make sure that anyone out there who probably gave birth to a preemie and they wrote that preemie off, they are not God. Just keep depositing love, care, and your best in your kids. Keep on believing they will become whoever God says they will become. I know if you guys see my daughter, you will see her so grown and all that. You will think she started that way. No, it is a product of love. It's a product of consistency. It's a product of God. Okay, so but right now, let's talk about your questions. So ask your questions, please. Okay, thank you. For women who do not ovulate, what options do they have to become mother? Very beautiful question from Chinyere. So here's the deal. Every singular woman who is in our group, I want you to pay attention to 6 months and 12 months. If you are regularly meeting with your partner every other day, that's the 48-hour concept, and you're praying to God. And if you are below 35, and after doing this for 12 months, you have not checked, you didn't get positive pregnancy test, please escalate. Because at that point, at the 13th month, you have infertility. So infertility is defined as the inability to become pregnant after a period of consistent, regular lovemaking and every other constant is there. Then after 12 months, if you are not pregnant, then you have infertility. Now, if you are 35 years and above, and you have done this for 6 months, then you also have infertility. If you are 40 up, immediately. So why am I saying this? The older you are, the more difficult it becomes. The more the need for you to go and meet a fertility specialist. So if it's confirmed, the watchword is confirmation. So I don't want you to base your thinking or your assumption based on what you can see. Oh, I don't have my cervical airway mucus. Then you say you're not ovulating. You can't see ovulation. So you need to do what? Contact a gynecologist immediately. When you have contact with a gynecologist, we're going to do a baseline check. We're going to check your hormones. We're going to check everything. We're going to take your history. Then if we confirm you are not ovulated, then we are going to come in. So that's where we will probably give you ovulation induction drugs. This is the class of drug where you have your Clomid. So if we know you have the eggs, but the problem is that you're not getting the eggs out, then we'll induce the eggs. This is the same drug we will give you if you're going for IVF. So a woman that had a confirmed ovulatory problems might benefit from fertility drug. Now, if that fails, we can escalate. So it's always good to start from the bottom up. So if the fertility drugs didn't work, we can go to IUI, intrauterine insemination, which is also called artificial insemination, right? So we can do that. So if we're doing if you are doing that kind of procedure, what are we doing? We can either use your natural cycle. If we know you are gonna ovulate, then we bring the sperm closer by injecting it directly into the womb. Now, if we confirm that you are not ovulation induction drugs, so about the time we know you're going to ovulate, we're going to bring the sperm in so that we can allow it to do its natural role. If that fails, we escalate further. So if fertility drugs fail, we go to IUI. If IUI fails, we go to IVF. IVF is the top echelon. IVF is like the big boy in fertility management. So if every other thing fails, you step up to go to IVF. So if you're in my community and you are having problems with your ovulation, it's not something you will just say, oh, I'm thinking about it, I'm wishing. No, you have to take concrete action. So you need a fertility specialist, especially if you're above 35. Because when you get to 35, it begins to be more difficult. Okay? Let's continue, guys. How can a woman release more than one egg in a month? Now, some women can release more than one egg in a month naturally. That's what we need to what? Multiple pregnancy. So if you have 2 eggs released instead of 1, and you have 2 sperm fertilizing the 2 eggs that got released, you're going to have non-identical twins. Now, if we are intervening, that means the fertility specialists, we are coming in to take over your body. We will give you what we call super ovulation drugs. So we're going to tell your ovaries, you know what, for the month of March, we're not going to wait for the eggs you're going to give us. We want you to give us all the eggs you have that you can give us in real time. So if you're younger, when we give you ovulation induction drugs, you can give us 20 eggs. You can give us 30 eggs. You can give us 15 eggs. That process of getting more eggs is called super ovulation. It's under the control of fertility drugs. So there are some drugs we can give a woman who we can confirm that she has eggs. I want you to listen to me carefully. If it's confirmed you have eggs, so how do we confirm? You go for your ovulation, test. You go for your ovarian reserve test, AMH, FSH, estrogen. So if it's confirmed that your AMH is within the normal range, your FSH is not high, and we confirm the eggs are there, then we can induce you. But listen to me carefully. If you don't have eggs, if you've gone into menopause, if you have poor ovarian reserve, giving you any induction drug is waste of time. I'm keeping it real. I wouldn't want to deceive you or give you fake hopes. You can only use what you have. So if we confirm you've gone into menopause or you've gone into primary ovarian insufficiency, which is premature ovarian failure, when you don't have eggs, you don't have eggs. If you have eggs, you can use it. Now, some people will come and say, please disregard that. We have some people that are trying to spam our group. They are posting a couple of nasty things. Please disregard them. That they're not part of our group. So if you have such, the earlier you go seek help, the better, because as you're getting older, it will keep becoming difficult. But once it's confirmed that you are no longer able to give birth with your own eggs, seek help. Go for donor eggs. The earlier you do this, the better. The more you are delaying, the more difficult it's going to become. Okay? All right, guys. Keep asking your questions. Okay? Let me see. Can someone be pregnant and still see her menses? No. Once you are pregnant, any form of bleeding you experience during pregnancy is called what? Abnormal bleeding. You cannot menstruate when you are pregnant. It's completely, they are not in sync. It cannot happen. So all the women that go about telling other women, oh, doc, my sister was pregnant, but she bled she saw her menses throughout her pregnancy. It's not true. It's simply bleeding in pregnancy. And you have to report it to the doctor immediately. Okay? Okay, let's see. All right. What does a milky discharge before period means? Now, every woman is supposed to have physiologic discharge. Physiologic discharge means this is the way your body cleans the whole internal reproductive system. The body is self-perpetuating. The body is self-protecting. The body is self-cleaning. It doesn't need your soap. It doesn't need your perfume. It doesn't need your anything. It can take care of itself. So every woman is supposed to have that physiologic fluid, which cleanses the vagina. Now, that fluid is supposed to be clear. It's supposed to be a little. It's not supposed to be a lot. It's not supposed to smell. But the moment you begin to have color discharge, is a signal that something is going on. We need to fix. That signal might be allergy. It might be inflammation. It might be infection. It might be a sign of growth. So any woman in our community who notices that they have discharge a lot, colored, itchy, there's a problem. Now, you also need to be careful. Remember, I mentioned the cervical egg white mucus. Now, some women, in cause of sexual intercourse, when that urge is high, your body begins to release fluid. It's completely normal. Now, that fluid, you can see that fluid, you might look a little bit like pap. It's completely okay. It's not an abnormality. But when you are not in that zone and you notice you have greenish yellow discharge, brownish discharge, blood tinge, discharge. Darkened, discharge. There's a problem. We need to figure out that problem and we need to fix it. But you need to understand the thin line. Your physiologic discharge is completely okay. When we begin to have problems is when it's colored, when it's a lot, when it's smelly. The type of smell your discharge will exude can give us an idea if it's parasitic, if it's viral, if it's bacterial, if it's fungal infection. So the key word is to know when to begin to seek for help. I love that question. So let's continue, guys. Can ovulation be boosted? Now, if you follow my logic, you can only have and you can only give what you have. Okay? So the concept of, oh, don't give me something that will boost my eggs. I'm being very real. The way your eggs is structured, it's there. What you have, you have. Now, your lifestyle can help you to potentiate what you already have. There is no magic drug that once you give, it will boost your eggs. There is no such drugs. What we do, like I explained, we can give you ovulation induction drugs. By standard, you already have the eggs. So your lifestyle can make the eggs that God gave you already poor quality. But improvement in your lifestyle can help you to use what you already have. I don't know if I'm making sense. So there is no drug they will write, egg boosting drug. Once you take, you begin to have all the perfect eggs in the world. No. But if you modify your lifestyle, if you eat properly, you drink your water, you exercise, you sleep, you avoid stress, you see your doctor, everything that God gave you will work the way God planned it. But if you begin to cut corners and do things by yourself and take a lot of artificial stuff into your body, then you're not helping your body to perform perfectly. And there is none, I stand to be corrected, there is no one drug called egg booster, ovulation, this and that. They are all carnal. If you need help, you see a fertility specialist. If we need to give you fertility drugs, we'll give you fertility drugs. Okay? All right. It's their natural ways to achieve this: adopting a healthy lifestyle, drinking a lot of water, sleeping, avoiding stress, exercising. If you can do all this, you incorporate this with good diet, you're going to help your body perform the way God planned it to perform. You've been married for 15 years, no kids. Now, the question is, this 15 years and no kids, is it primary? So primary means, have you ever been pregnant in your life? If you have never been pregnant and up to 15 years, you still don't have a kid, you have primary infertility. It's more difficult to treat. Now, if we add 15 years to your now age, you're probably going to be in your perimenopausal phase. So the question is, what are you going to do, Tiffany? You need to do something different. You cannot afford to just count another 16 years. So personally, you're a candidate for IVF. Now, if you're in your 40s, you're a candidate for IVF with donor eggs. You cannot count the number of years you've been having infertility without having results. We want you to have results. So I want you to have a baby at the 16th year of your marriage, okay? So you need to get some help through a fertility specialist, okay? Let's see what we have. Can a woman determine the sex of her baby by meeting her partner at a certain time during her cycle? So that's a non-reliable avenue. So there are so many schools of thought that believe, oh, the sperm is fast, the egg is this. If you make love on a particular day, you get this gender, but they are not reliable. The failure rate is almost 99.9%. If you are interested in having a particular gender, there are reliable avenues you can achieve this. Matter of fact, by the grace of God, in our group, next month, we're going to go to this gender selection thing, because so many people have been asking about, oh, how can I get this gender? What can I do and what can I not do? We're going to go there again. We normally teach this particular class every year. So we're going to go there again so you can understand. But the only reliable avenue for you to have a particular gender is to go for a particular process of IVF. Okay? I love that question. For some reason, I've not seen any question from Kenneth, my COO. I don't know if she's having problems. But guys, let's round up. If you still have any questions, you can ask and we can go. Okay, let's quickly report this message from this, person that is trying to spam our group. So I've reported. Let me quickly report this. So please, if you still have questions, go ahead and ask, and I'll give you a feedback in real time. I apologize for this particular content, which is not in tandem with the community in YouTube. YouTube is a very respectable community, so we don't entertain any of such. It's not in our character to do that, okay? So I think I have one more question. Okay. Okay, you are 44, you are not ovulating anymore, but your doctor said you have X, but there is fibroid inside 6 cm and you have not given birth at all. So I can see a lot of denial, my sister. So I'm going to tell you the truth. If you're 44 and you're telling me you don't ovulate, how did you know you're not ovulating? Then you are contradicting what you just told me by telling me that your doctor said you have X. So I can pinpoint two things you're dealing with here. You're dealing with fibroid. 6 cm is appreciably big, right? Now, if it's confirmed you are not ovulating, then you need to step up your game immediately. So this is what you need to do. Go and remove that fibroid if the fibroid is significantly affecting your fertility. So what do I mean? If your fibroid is inside your womb, that means it might be intramural or it might be submucosal. Remove it. 6 cm is appreciably big. Then you go back to a fertility specialist this time, not just any doctor. Because you're 44, you are perimenopausal. So that means you're warming up to get to menopause. Okay? Now, if it's confirmed you are not ovulating, at 44, personally, I will advise donor eggs. So you use donor eggs, you get your pregnancy. Hopefully, you might have more than one. That's all you need to do. Stop living in denial. So many people are in denial. Oh, my person told me this, but I'm not this. The more you're denying yourself from January, by the time you get to December, it's still the same thing. You're still stuck in the same position. So you need to be very decisive. Certain things might not be pleasurable, but you need to tell yourself the truth. Like a woman at 50 that wants to become a mother, you don't need to think that you have all the time. You just need to do what you need to do at 50 to become a mother by using the chances you have, okay? All right. What's the standard level of FSH? So I'm not going to throw numbers out here because it's unethical. If your provider requested you for FSH, depending on the lab values, depending on where you live, they will send you to a lab. When the result comes, I want you to focus on the range. If your FSH number, let's assume you got 10, and the range is 5 to 25. 10 is contained in 5 to 25. So that's normal. But if your FSH is 50, when the upper normal range is 20, then that means your FSH is high. Your FSH comes into play based on your age. If you're hovering around 40 and your FSH is very high, your estrogen is very low, your AMH is very low, likelihood you've gone into menopause is very high. So we cannot single out just FSH and begin to use it. We tie it together with so many other things and we arrive at a diagnosis. Okay? All right. Form the habit of taking your lab results to the doctor that requested it so they can interpret it, tie it with your examination, tie it with your history, and come out with a diagnosis. Very, very important. Okay? Okay. Okay. Yeah, thank you guys for, wishing Zara. Zara is an amazing daughter. I can't ask for the best. Please, doc, how accurate is ovulation test strip? It's not perfectly accurate. It can, to an extent, give you an inkling, but don't go putting all your hopes there. Sometimes they might give false positives, sometimes they might give false negatives. The most important thing, remember when you're doing all this, you're just expediting. It doesn't mean you now have to wait. So while you're doing your ovulation test, while you're waiting for your cervical airway because still continue meeting with your partner. That's the borderline. That's how you get pregnant, by meeting with your partner, regardless of your diagnosis. Okay? Good afternoon, doc. Does nursing mother ovulate? Yes, you ovulate. And this is where you need to be careful. Some women might be waiting for their period to come back, but they have ovulated. So if you're a new mother, use reliable contraceptive. The possibility you release your eggs before you bleed is 99%. So you might not bleed, but you're making love with your partner, and 2 or 3 months after delivery, you can become pregnant again. So the answer is what? Yes. In a good hospital with a good fertility provider, before you go home, we advise you on contraceptive, because if you continue making love, regardless of the fact that lactational amenorrhea can actually lead to passive contraceptive. So lactational amenorrhea means when you're breastfeeding your baby, part of the hormones that will help you to breastfeed your baby properly is prolactin. That prolactin will affect the other hormones from ovulating, but some women can still become pregnant. So we don't want to take chances, okay? So you have to use active, reliable contraceptive so that you will not become pregnant. The general rule of thumb is to give yourself 18 months before trying to become pregnant again once you have a baby. 18 months. Some women can have modifications based on their age, but generally across the board, when you have a baby, allow your body 18 months to recover before becoming pregnant. There is a difference between giving birth and becoming pregnant. You have to allow 18 months before you now want to become. The sooner you do that, the more it's going to put a lot of strain on your health. Okay. Does ovulating guarantee pregnancy? No. There are so many factors that come into play in pregnancy. So many, including factors that will come from the man. So if it's coming from the man, we want to look at the sperm. You want to make sure it's a good sperm. A good sperm will have a head, a middle piece, and a tail. So the male factor must be, activated. The man must produce good sperm. Everything must be good in this direction. Then we come over to the woman. Everything must be perfect in this direction. So if you are ovulating, it's one part of the equation. We also need to look at your tubes. We also need to look at your hormones. We also need to look at your body weight. So there are so many factors that come into play before you become pregnant. Pregnancy is a delicate, complicated process. So ovulation doesn't guarantee you pregnancy. Okay, guys, we've even reached 40 minutes. So thank you for coming. If you notice, this particular topic is a topic that should get you pregnant. Ovulation is the common denominator in our group. If you understand ovulation better, then you're on your own pathway to becoming. So share this video with anyone it's going to help. If today is the first day of attending my open clinic in YouTube, thank you so much. Without you guys, I won't have this platform. I truly appreciate you. Please take time and subscribe, comment, like, share, and tell other people about our group. We are in a very group in our community in YouTube. So anytime you show up on Tuesdays, 12 p.m., sorry, Tuesdays should be 6 p.m. Eastern Time, US, and in Nigeria, it should be your 11 p.m. But weekends are coming a little bit early, which is 12 p.m. Eastern Time, and it should correspond with your 5 p.m. Okay, so thank you so much, and please apply what I've taught you guys today. Tiffany, especially, I don't want you to have another 16th year of not having a baby. There are so many ways you can have a baby. So I don't want you to, relax. Sometimes we might not want to relax. Sometimes we might not want to be in our comfort zone, but we give up before even trying. There are some women that present for babies. They want to become pregnant, but they are presenting as a defeatist, passive mother wannabe. You have to see your babies in the future. You have to envisage them, then you do what you need to do. Now, tomorrow, if you register for our boot camp, I'm just going to give you the best pathway to enjoy the programming event tomorrow. Make sure you are fully registered. Make sure you have your Zoom ready. When you are done doing that, show up. The ability to show up, the responsibility of showing up, it's on you. When you show up, please follow the trends. It's going to be an amazing time. The class is already sold out. So we're looking forward to sharing our knowledge with you guys in our multiple pregnancy bootcamp, one of the best events to happen in 2022. So I'll see you guys tomorrow. Until I see you, take good care of you, and God bless you, and bye-bye for now.